The Director General of the World Health Organization (WHO) said China's zero-tolerance COVID-19 policy is not sustainable. The statement is a rare public comment by the UN Health Agency on the government handling of the pandemic. Tough COVID-19 measures have trapped most of Shanghai's 25 million people at home for several weeks as China tries to stamp out the country's worst outbreak since the pandemic started. Speaking at a media briefing, Dr. Tedros Adhanom Ghebreyesus noted the behavior of the disease caused by the coronavirus and what experts anticipate in the future. He said further that the WHO has discussed with Chinese experts while adding that a shift in COVID-19 policies would be very important.
About the zero COVID strategy, we don't think that it's sustainable considering the behavior of the virus now and what we anticipate in the future. And especially when we have now a good knowledge, understanding of the virus, and when we have good tools to use, transiting into another strategy will be very important. We have discussed about this issue with Chinese experts, and we indicated that the approach, will not be sustainable. And considering the behavior of the virus, I think a shift will be very important.
In his part, the WHO Emergencies Director, Michael Ryan, said it was time for China to reconsider its approach, saying any measures to combat the COVID-19 pandemic should show due respect for individual and human rights. Elsewhere in China, Beijing further tightened COVID-19 curbs on residents on Monday, with more mass testing and road closures as the country continues with its uncompromising battle with the virus. Residents of the city's worst hit areas were told to work from home, while more roads and compounds were sealed off as the capital of 22 million people grappled with its worst outbreak since 2020. There have been 220,397 infections and 5,191 coronavirus-related deaths reported in the country since the pandemic started. Kamel Sadiq, CBA TV.